Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwonka. Here are some of the highlights this hour. More states in Nigeria announce reopening of schools next week as federal government also orders resumption of all unity schools on October 12th. Sokoto State government scales up community testing and coronavirus enlightenment campaigns across the local government areas in the state. And U.S. President experiencing mild symptoms of COVID-19 after testing positive with his wife Melania begins self-isolation for 14 days. According to the Nigeria Center for Disease Control (NCDC), everyone has a role to play to reduce the spread of COVID-19. Quite a number of people who are infected with the virus are asymptomatic but can spread the disease to others. It says you should continue to follow the safety guidelines and avoid non-essential social gatherings to remain safe. On the 1st of October 2020, the NCDC reported 153 new confirmed cases in 13 states and the Federal Capital Territory. Lagos confirmed another high of 81 cases, as you can see there, followed by Rivers State, 21 cases, and the Federal Capital Territory, 11 cases. Lagos State is still the epicenter of the virus, managing over 4,000 cases, followed by Oyo State, Plateau State in third place, before the Federal Capital Territory at 665 cases. Apart from Enugu, Gombe, Rivers, and Nasarawa states, other states have below 100 cases on admission. 94 discharges were reported in the last 24 hours in 6 states. Plateau discharging the highest at 45, followed by Rivers 29, Kaduna 10, 5 were discharged in Ogun, 4 recovered in Akwa Ibom, 1 in Ebonyi. However, no death was recorded in the last 24 hours. Till date, total confirmed cases has surpassed 59,000, while 50,452 cases have been discharged, and the death toll is at 1,112, recorded in 36 states and the Federal Capital Territory. Now, Africa's most populous nation has tested over 520,000 of its 200 million population. Nigeria is in 4th place with the highest number of cases in Africa. This is after South Africa, Egypt, and Ethiopia. The West African nation also ranks 55th in the global numbers. Now, according to the governor of Adamawa State, his administration is not resting on its oars in the response to COVID-19. Governor Umaru Fintiri gave the assurance while kick-starting the rehabilitation and upgrade of all secondary healthcare facilities across the state. He says that the COVID-19 pandemic has indeed exposed the weakness of the country's healthcare delivery sector, and he strongly believes that upgrading the facilities in the state will help contain the spread of the virus and other infectious diseases.
The case for the upgrade of Mobi General Hospital has become more compelling in view of its strategic location as an international gateway and the only facility providing health services for millions of our citizens in the entire northern zone of the state into the southern part of Borno. The COVID-19 pandemic has not only exposed the weaknesses of our health infrastructure, but the gross inadequacy of the facilities required to confront contemporary public challenges. May I use this opportunity to assure the people of Mobi that the current project, which involves the construction of outpatient, maternity, laboratory, and theater complex, will be pursued with the utmost vigor and will be completed in 6 months' time, so that the people of Mobi will enjoy improved health services in no distant future.
Over in Katsina State, the government is training over 400 selected heads of school and principals of various public and private primary secondary schools operating in the 34 local government areas of the state on COVID-19 preventive measures. The State Commissioner of Information, Culture and Home Affairs and the Chairman of the Publicity and Risk Management Committee on COVID-19, Mr. Abdul Karim Sirika, says the aim is to sensitize all the stakeholders so that when schools reopen, the NCDC COVID-19 protocols for pre-reopening of schools in the state can be effectively observed. Katsina State has recorded COVID-19 cases in almost all the local government areas, while over 20,000 samples have been tested. 864 cases are confirmed, and the state has recorded 24 deaths. The federal government has ordered the reopening of all unity schools in the country from Monday, October the 12th. The Minister of Education, Mr. Adamu Adamu, says the decision to reopen schools was taken after wide consultations with stakeholders and the Presidential Task Force on COVID-19. He explains that COVID-19 has come to stay and schools across the country are at liberty to fix resumption dates, however, with adequate safety measures in place. He cautions that school owners who fail to comply with the safety standards risk closure if there is any outbreak due to negligence.
After consultation with the Presidential Committee on COVID-19, we have decided that all our 104 unity schools should open on the 12th of October 2020. States and private owners will work out the modalities for the opening of schools under their purview. Gentlemen of the press, as we all work towards the opening of learning institutions nationwide, I strongly urge school owners to put in place systems that meet the following conditions. There should be procedures for self-distancing as much as possible and in as many situations as is practicable. Develop and display at schools simple context-specific reference protocols on day-to-day actions to be operated in each school. Conduct risk assessment with a view to understanding the gaps in the system that can increase the risk of transmission and make recommendations for addressing this. There should be safety and hygiene in all stages and all phases of the school opening process. Something like self-distancing, frequent hand washing, use of face masks, and so on. There should be sensitization and monitoring procedures while all these are going on. Let me warn that any school owner who does not comply with these guidelines and an outbreak occurs in the school due to negligence, they risk closure of their schools.
In the meantime, the Imo State government has fixed Monday, 5th of October 2020 for schools to resume across the state after months of closure due to the coronavirus pandemic. Here's more with our correspondent, Itokwe Kutei.
Cherry news for schools in Imo State as the state government has fixed Monday, 5th of October for schools to resume across the state. The State Commissioner for Information and Strategy, Declan Emelumba, disclosed this after the weekly Executive Council meeting at the Government House in Owerri, the Imo State capital. He said the government has also set up a committee led by the Deputy Governor, Placid Njoku, to ensure that the schools adhere strictly to all the COVID-19 protocols when they resume.
The ESCO agreed resolved that all schools in Imo State should resume on Monday. That's next week, Monday. However, this is subject to a committee that the government has set up to work out the modalities for ensuring and enforcing COVID-19 safety protocols to make sure that when the students return, they are safe. That committee is chaired by His Excellency the Deputy Governor, Professor Placid Njoku. But it is expected that the committee will have finished with their recommendations and submitted so before Monday. So we are expecting and very optimistic that all schools will resume in the state by Monday.
And that's it for now. From Owerri, the Imo State capital, Itokwe Kutei for COVID-19 updates.
Now, a recent study was released by Kenyan Professor Kimatu, which talks about how antibodies show that Africa has achieved acceptable COVID-19 resistance. The professor was trying to give scientific reasons why the current COVID-19 was not a threat in Africa, and hence schools and universities should reopen. We have joining us from our Abuja studios infectious diseases specialist, Dr. Abdul Jalil Tafar-Balewa. We'd like to thank you for joining us on the program and begin by asking if you agree with some of the reasons Professor Kimatu had to say with regards to how Africa has achieved some sort of immunity against COVID-19.
Well, the reason is based on science. There are about 40,000 different coronaviruses, most of them come in form of flus, and a lot of Africans come against these viruses over time. So when he said we're getting closer to herd immunity, he's very right about that.
But does the level of testing on the continent reflect some of the things that he has also talked about? I mean, getting to that point of immunity. I mean, take Nigeria, for example. We have schools opening up, and we have several decisions that the federal government has taken, but we also know that we're not testing as much as we should be.
We're tested 1 out of every 50,000 people in Nigeria. That is not good enough. However, from works done, for instance, at the Epicenter Africa, which is the research arm of Doctors Without Borders, and the work you mentioned earlier from the epigeneticists, we are just lucky that, you know, we're able to already, maybe some of us have some of these antibodies in our bodies already, or close to that. A lot of studies have been done also by the French in Ghana, Cameroon, Benin, Senegal, to test Africans and their antibody reactions to COVID-19. And the result of that is supposed to come this October.
So if we look
the
at...
World Health Organization has...
I just wanted to quickly ask that, you know, if we
saying?
look at compliance to the non-pharmaceutical protocols, do you think that notions such as immunity, for example, or even that because we have a black skin, because of our weather, or the youthful population, even though not maybe scientifically proven, that this might be leading to complacency with regards to the non-pharmaceutical protocols?
Well, one of the things that is on Africa's side is our youthful population. For instance, Kenya, the average age is about 20, in Malawi, 18. In Spain, it's 45. Now, for the youth, there's cytokine storms. This is their reaction to their immune response to an attack on the body. Is usually very virile, and this may be one of the things that works better for us, but I think that we're being too complacent. This is real. COVID-19 is real. We heard the news today about the Trumps, and you know that there's nobody else in this world who exhibits machismo against this disease like the Trump family, but you can see what happened to them.
So finally, if some regions are experiencing twindemics, a second wave, what would you call what stage Nigeria is in?
Nigeria cannot even boast of taking care of a first wave. Testing 1 out of 50,000 people in a country like ours is really terrible. We don't know what the second wave will be. A lot of people that were tested were never, their contacts were never traced. I can say that categorically because I didn't get my result for 25 days. The rest of my family got theirs for about 18 days from NCDC, and that's in the capital city of Abuja. Also, our testing areas are using the converted tuberculosis machines that does only 4 tests every 2 hours. This is not good enough. We really don't know how many people within our population may be carrying the COVID-19 virus. That is one. Also, we don't know about the number of deaths we have because there are cultural things that prevent knowing the actual numbers. One, in Islam, you cannot do post-mortem unless there are extenuating circumstances. So we don't know how many people are infected, how many people died with COVID-19. We don't know what is going on, especially with our youth, because they may present only one symptom, maybe a fever, and it can be accompanied by diarrhea or cough, but there's nothing specific to COVID. We don't know whether we have really maximized on the testing on the first wave.
All right. We'd like to appreciate your time. Thank you so much, infectious diseases specialist, Dr. Abdul Jalil Tafar-Balewa. Thank you for joining us on the program.
Thank you for having me.
We have more on the global response to the pandemic when we return. Please stay with us. Welcome back. The chairman of the task force on COVID-19 in Sokoto State and Commissioner for Health, Mr. Mohammed Iname, has been giving an update on the coronavirus situation in the state. It's been 5 days since the last recorded case of COVID-19 in the state. The commissioner says that they have resorted to community testing in the 23 local government areas of the state and that efforts are in place to continue to sensitize members of the public to follow the COVID-19 protocols. He also adds that a date for school resumption in the state will soon be announced and that all necessary arrangements have been made for that.
We have recorded 162 confirmed cases. We have one single active case that is on admission right now. And we have been able to discharge 144 patients. And we have also recorded 17 deaths or mortality as a result of COVID-19. We have been carrying out community testing and we have been able to get about 3,800 samples that have been collected. 3,800 samples, and we have ensured that each and every local government of the state at least there is a minimum of 10 samples that have been collected. We have not rest on our own. We'll continuously, we have been hearing jingles, we have been talking to people to make sure that they observe these protocols. Hopefully, any moment from now, we are going to the resumption of the overall school resumption will be announced, both for primary, secondary, and the higher institution in the state. And we are working tirelessly to make sure that all the protocols are being observed in the school by ensuring that children and students have face masks and also there are available hand washing equipment in facilities in the school.
Let's now take a closer look at curbing community transmission. Dr. Taufik Sani is the Senior Registrar, Department of Community Medicine, Federal Teaching Hospital, Ido-Ekiti. He joins us via Skype. Thank you for joining us on the program. I'd like to first ask what you make of the federal government's claims that we are flattening the coronavirus curve.
Yes, the claim that we are flattening the coronavirus curve cannot be disputed, because we can see that it is evidence-based. When the values and figures were high, the federal government announced. Now with our testing, if the values are going down and we claim that it is going down, nobody can argue that because we don't have any other evidence against that. I would say that it is true that the flattening is being flattened, but the other question that we must ask ourselves is, are we testing enough? That's the question. But for the testing that we are doing presently, the curve is being flattened.
But Dr. Sani, many are asking, do we have a strong community response, a strong engagement such that with our schools, reopening, we will be able to manage more cases, and this is should they arise?
Yes, I would say before now, we actually had a very strong community engagement, and a lot of people are very conscious of the COVID-19 pandemic. You see a lot of people on the street having their face masks, people bought their own personal hand sanitizers, go to every household or school, you see people washing their hands and all that. But I think this response is reducing. I've been meeting people on the road now not wearing face masks, even shopping malls, areas that people are gathering, people are not really enforcing the use of face masks anymore, really. And the community use of maybe washing, hand washing, use of hand sanitizer is also reducing. People are also not observing the social distance, the physical distancing anymore, like it was before. I would say that I had a very strong one initially, but maybe because the is being flattened down, people are now reducing their commitment in the observation of the preventing measures of COVID-19. And this we must encourage people not to relax, as we need to do more this time around. There is second wave of COVID-19 all over some countries of the world now, and we need to be prepared in Nigeria.
And we must continue to drive the initiatives. We appreciate your time on the program. Dr. Taufik Sani, Senior Registrar, Department of Community Medicine, Federal Teaching Hospital, Ido-Ekiti. Thank you for joining us on the program.
Thank you for having me.
President Muhammadu Buhari has joined all citizens of the United States in prayers for the quick and full recovery of President Donald Trump and his wife Melania, who tested positive to COVID-19. President Buhari, in a tweet, notes that with sympathy that the incident of COVID-19 in the White House manifests the challenge posed by the pandemic across the world and difficulty in containing the spread. While wishing the American First family speedy turnaround in their current health status, President Buhari is urging for more compliance among Nigerians to protocols and adherence to advice of medical doctors, particularly epidemiologists. President Trump is said to be experiencing mild symptoms, while Democratic nominee Joe Biden has announced that he and his wife have tested negative to COVID-19. Here's more on the global updates.
Spain has imposed tighter restrictions on movement for people in and around the capital, Madrid, where most of the new cases have been recorded. Under the new restrictions, 4.8 million people in the capital and 9 nearby municipalities will see borders closed to outsiders for non-essential visits, with only travel for work, school, doctor's visits or shopping allowed. Restaurants and bars will shut earlier. Elsewhere in Europe, masks will have to be worn outdoors in the Italian capital Rome and surrounding areas from this weekend. A health official for the Lazio region says only children under 6, those who cannot wear face coverings for medical reasons, and people exercising will be exempt from the rule. The head of the European Union, Ursula von der Leyen, says the European Union is in talks with more companies to secure potential COVID-19 vaccines, as she warns of the worrying spike in infections in Europe.
Progress on vaccines is the key to a long-term solution to this crisis. We are making good progress. The Commission has already concluded 2 advanced purchase agreements, and it is negotiating 5 more. And we are in discussions with 4 more companies. So this is on a good track.
To date, the Commission has announced supply agreement for the potential vaccines being developed by AstraZeneca and by a partnership between Sanofi and GlaxoSmithKline. In the United States, Amazon says more than 19,816 of its frontline workers have contracted COVID-19 since March. The number equates to 1.44% of its 1.37 million workers and its subsidiary Whole Foods. And finally, some good news for New Zealanders who are planning to travel to Australia. They are to be granted access to the country in the first opening of international borders by either nation since COVID restrictions were imposed. People will be able to fly from New Zealand to New South Wales and the Northern Territory and avoid mandatory quarantine from October 16.
And while we wait for vaccines and as we go into the weekend, continue to take responsibility. You can also visit our website, channelstv.com. There you get more updates, also a better understanding of the pandemic. That's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker.